I'm Abby.
I'm Siklali.
I'm Patience.
I'm Lakeisha.
I'm Kyra.
So we're going to be starting for discussion 3. And the first question from the discussion would be, why do you think Mr. Davis responded to Alicia the way that he did? I wrote down, after watching the video, I put down Mr. Davis' response to Alicia could be connected to him feeling neglected in a way, but also not fully understanding that the nurse has other patients to take care of. So maybe he just thought in a way, it's a little selfish to think that way, but he doesn't fully understand why she has to go give medication, that it's more important than him walking at the very moment, even though she did suggest that she can get someone else to assist him in walking.
Yeah, I pretty much went around the same lines. I also put that he probably wasn't sure how to respond, just because the same thing of being told that she has all these other patients that she needs to give meds to first, probably made him feel like his recovery wasn't as important or wasn't as a prioritization as everything else. I think maybe Alicia could have probably gone about it a different way and just told her like, hey, I need to review the charts just to confirm like if there's anything else the doctor said that needed to be done, as a way as a segue of like being able to excuse herself from the room and then come back once she was done doing the meds for the other patients, just because I don't think a lot of patients understand the whole you're not the only patient that the nurse has at that point in time, and there could be other things that are more important right now, not to say that that patient's not important. And then I also think she probably could have asked Mr. Davis if he needed anything right then and there before she left the room, because she kind of just left. So that probably didn't help with making him feel like he wasn't important.
Yeah, I agree with you, because like you could tell Mr. Davis, he was already kind of frustrated with like how he was like, yeah, I guess, and then he like threw his hands out. He's like kind of scrunching his face. So like all those cues she could have picked up on too.
She, I think I should say, really kind of just seemed very dismissive of him almost. And so I can understand why he would feel the way that he did, because yes, while the other people are important, medication is important, and he just needed to walk, she was a little bit of dismissive of him at first, kind of just like, oh, well, I have to do this. And then as an afterthought, but I can have someone else do this.
Yeah.
So I can see why he would feel the way that he did.
Yeah, I agree with you guys. Like, I put the kind of the same thing, that she could have gone about it a different way. Like, made him be like, okay, like I will be back to, help you walk, or I'll have somebody else come in and help you walk just because I'm busy at like the moment. And that way he didn't feel neglected and he felt heard instead.
Nice. Yeah. Second question is going to be, when staff resources are low, what might a charge nurse consider to maximize staff efficiency? I only put 3 things down. I wanted to hear you guys' ideas also, but I put prioritizing like the task that's most important, and definitely time management and having a clear and crystal communication so everybody like fully understands.
Yeah. So I put that, I think the charge nurse, so I don't know what was done during this video, but like, for example, I think the charge nurse should go around and see if any of her staff needs help more, just because in this video, I'm not sure if that was a charge nurse that told her that her patient was in MRI and that, there wasn't going to be any transportation and that they were in pain, but it didn't really seem like that nurse was really wanting to help as much, just relaying information and leaving. But just going around seeing if any of the nurses on the unit needed any help, just because typically charge nurses aren't usually included in ratio, I guess depending on how many patients there are in the units. Another thing a charge nurse could do is probably try to make sure that the patients that are being assigned to a nurse are all within the same side of the unit and not just all over the unit, so the nurse isn't running from one side to the other, just because units are pretty big. And then maybe also dividing up patients between like heavy and light workload. just so that way one nurse doesn't have all the difficult high acuity patients, and one nurse has like all the easy, can do everything on their own patients. That way it's all divided equally, and it probably helps also reduce like the chances of being burnt out. But that's what I put down for charge nurse.
Yeah, I did the same thing. Just CSs should consider acuities. The peers should be checking on each other because we're all a team. The charge nurse, as being the supervisor of the unit, if she knows we're low on like assistance for the night, she should be making like an extra round or two to check on everybody. And also as the nurse, like if you're flustered as the nurse was, should have went to her charge nurse and advocated for herself and the patients, because she did have like two main priorities that she couldn't really push off.
I also put that they should communicate, especially, or she should communicate, especially if they're like low in staff or like that CNA she called out. So I think just informing the staff like, hey, we're short staffed tonight. If you guys need anything, let me know. I think that would have been like a good idea, just so that way everybody's on the same page and they're not like running around scrambling.
As Lolly said, that it was like, I think that was the charge nurse, as you said, but she kind of just seemed like she was pushing it off to her, when you could tell that when she was giving her, oh, they're out of MRI, he's in pain, and it's going to be 45 minutes of a wait, instead of offering to see if she needed any help or if there's anything else she can do, she kind of was just like, okay, hi, bye, and then wasn't very like supportive of the team. And I mean, I don't work in healthcare yet, but I work within a team somewhere. And as the supervisor, you're supposed to make sure that the other staff are always, feeling cared for, because again, burnout. And also, while we all matter, the patients matter. And so you want to make sure that they're getting the adequate care, and they can't if everything is put onto one nurse.
Third question would be, what should Alicia priority at this time? And why? I think this goes off from like what the second question was for, because I put down safety for all the patients and given medication, the scheduled medication on time. But I think also adding to advocating for herself to make sure that she is getting some sort of help, because you can't do it all, especially if the last person getting discharged had like kind of like a time requirement and stuff like that.
Yeah, same thing. Yeah, she should be advocating for herself. If she can't get any help because everybody's busy, I think just trying to figure out which patients are most important and prioritize that way. So like, depending on the meds, if it's like a critical med that needs to be within like that 30-minute time frame, obviously those would probably have to go first if it's that time frame. But if they can be held off because they're not within that critical time frame, then hold off and then move on to the next one, which I think would probably be the patient that needed to be discharged so they didn't miss their flight. And then unfortunately, I think Mr. Baker would be at the bottom of the list, just because I understand that he is in pain, but he's also in MRI, and there's nurses down there that can, keep him stable until he's ready to come up to the floor. And at that point, he would be able to get the pain meds that he needs. But yeah, I guess it all just depends on like how critical the meds are to be passed out at, would determine the order of the priorities that she needs to sort out with the patients.
I kind of disagree with you a little bit, Zitlali, just because like I think you said you worked in the healthcare field as well. I do too, and the way because before I was a transporter and now like I'm a tech, they teach you like there's other people that can transport that patient. It can be a transporter, it can be a nurse, it can be the CT person themselves. Like there's so many other people. So like as the nurse, I know in one of our other classes, like it's very specific guidelines to what a nurse can do and what they can delegate. So I said as far as this prioritization goes, it would be like the medication first, because you can't pass that on to somebody else, and then it would be the patient getting back to the unit, because that's a safety risk and they're already in pain, and you can't just let that patient suffer down there. And sometimes there is a nurse down there, sometimes there's not. Like, I know hospitals are different and stuff. But the next priority, at least in my book, would be to get that patient back up, because it takes maybe 5 minutes or so to transport him, give him the med, and then move on to the discharge. And because like discharges are kind of unfortunately at the bottom, but since this one is time sensitive, it would be like, okay, now I can move on to discharge, because again, that could be delegated to somebody else. And then ambulation, that can also be delegated to somebody else.
Yeah, if there's somebody to delegate it to, like in this scenario, if there's anybody to. And also, I guess, just depends on how far MRI is from your unit, just because there's some small hospitals where it's only a couple of minutes away, but there's some other hospitals where they're literally in a different building. And it's like for example, the hospital that I work at, it's 3 buildings, and like you have to go to one floor to be able to get into the other building, and it's just like a weird little maze.
Yeah, I mean, it all
just depends on who's available to help and what actually needs to be prioritized. And if there was anybody down in MRI, like a nursing staff, that would be able to keep the patient stable until they're ready to transfer up. But yeah, definitely the ambulatory one could have gone dead last.
I agreed that the meds would be the first like thing that you need to take care of, because again, as you said, we don't know in the situation if they were like the 30-minute period, or if they had to be gone now, or what kind of meds that they were. But considering that they are meds, they are pretty important. And then with the person with the MRI, yes, someone was 45 minutes out to be taking them, but they expressed that they were in a lot of pain. And if they're going through the MRI, we're still figuring out what's wrong with them. So we have to take care of like what pain that they're going through to see. So they'll be one of the more important. But the ambulatory, I thought, would be the dead last as well, because I mean that doesn't prioritize over someone in serious pain in an MRI or someone who needs their medication.
Yeah, that's what I put too, is that she should finish her med pass first, and then take a look at all the things she needs to do and prioritize which one to get first.
Okay. 4th question would be, what would you do to ensure that Mr. Davis is ambulated, all patient medication are passed, Mr. Baker receives discharge instruction, and Ms. Stanford is transported from radiology? I just came down to the conclusion of like time management, making sure that they're done in like the priority, like from, greatest medication to least ambulatory.
That's what I put too, is to prioritize what patients, like prioritize from most, what's it called? Most severe to like least severe or something.
Same, the prioritization. And then I think also, so like you don't forget about any of the things that you need to do, especially when you're working on a unit and something else might be added to that list. Maybe even writing yourself like a short list, whether it's just like a couple words here and there, like ambulatory meds, MRIs. That way you keep track of everything that you need to do. And if anything gets added onto that, you don't forget completely about the patient. Because I know that's happened in the past too, where if there wasn't any transportation available, they've completely forgotten about patients that have been waiting outside of like certain areas for patients until hours later, when somebody finally passes by them. It's like, hey, what are you waiting here for? And it's always because they were forgotten or something. So I think having that little short list just to check off and make sure that you don't forget anything. And then also knowing that the unit is short staffed, you could still ask around to see if there is anybody that has a little bit more flexibility within their list of prioritizations, to see if they can help you, just because you never know if you don't ask. But that's all I have down on there.
Okay, now question number 5 is what nursing behaviors should be used to ensure all clients receive care as required? I said staying professional even when, things get stressful and hectic, but also having maintaining proper communication. And also having patient empathy. Yeah, showing empathy to the patient.
That's what I put too. I put be professional, even though it might be stressful. Just try to keep like a positive attitude. That way, things go smoother and your patients won't be as upset at you.
Yeah. Same thing. Stay professional. Try to prioritize. And then also I put honesty, just because I think letting people know that you need help and that you feel overwhelmed, can probably help out a lot, especially if it's just even a little bit of help to help you get caught up.
Last question would be, what is the eventual outcome for Alicia if the client care expectations are not met? This is kind of a jump, but I said getting written up because I feel like that would happen.
Yeah, I put she could end up getting like a disciplinary action placed against her, just because it is part of her job to be able to prioritize and delegate as needed. Just because unfortunately, even though you're slam and you're short staffed, management, as much as I don't like saying it, I'm like management really doesn't care. Like they only care about like the outcome and the numbers and like how that's reflected. They don't care that the reason this happened was because you weren't short staffed and that's something that you couldn't control.
Yeah, that's what I put too. I also put that they could, the patients could get angry at her, and then they could even like eventually hurt themselves if they're not getting the help that they need. Like if nobody came to walk him, he probably could have just gotten up and walked himself. And then if he was a fall risk, you know.
Yeah, I said the same thing. Fall risk, so safety concerns. Pretty much getting fired from the room because the patients are feeling like they're not being attended to, they're being unheard, and all that.
Yeah, I thought the same thing with the disciplinary action. I didn't think of the like safety risk aspect of it. I did think that, with if she gets a disciplinary action, she can also like personally start feeling some type of way about that because in her eyes she's like, I'm doing as much as I can, but there's like she might not feel as supportive and that could lead to eventual burnout. But that is more of like a personal thing rather than the like disciplinary action, like something that would happen at work instead.